And joining me now is Olivia Troy, who quit her job as a Homeland Security advisor to Mike Pence, assigned to the coronavirus task force in protest over its handling of the pandemic. Now an advisor to Defending Democracy Together, and Dr. Amish Adalja, senior scholar at Johns Hopkins Center for Health Security. Olivia, first to you. Let's talk about Mike Pence on the road today. How can he really defend being on the road instead of quarantining, given how closely he worked with Mark Short and several of the others on his team?
You know, Andrea, I don't know how he can defend that. He should be isolating right now. He has had significant exposure to staff around him. His own body man has it. He has other staff that have it. And Marty Obst, he is always around the vice president, and so is Mark Short. And it's disheartening to see the vice president, as the leader of the White House coronavirus task force, out there displaying this sort of blatant disregard for CDC guidelines and what we have tried to communicate to the American people in terms of what happens when you're exposed like this. And it's just disappointing to watch a leader of our country at the highest level continuing to perpetuate this type of narrative.
I mean, they say he's an essential worker, but campaigning is not arguably essential work. He could do his vice presidential essential work from the Naval Observatory, perfectly equipped there at home base. Dr. Adalja, how much trouble are the hospitals in Utah in when they're dealing with such an onslaught of cases and are talking about triage, basically?
Anytime a hospital is even contemplating crisis standards of care, it tells you that things are going out of control. So it looks like what's happened is chains of transmission have landed on vulnerable populations, landed them in the hospitals, and these hospitals are having difficulty maintaining their normal operations, taking care of ordinary stuff they do on a day-to-day basis because of all the COVID-19 patients. You have to remember that when we were talking about flattening the curve, it really was about preserving hospital capacity. We knew we couldn't get cases down to zero, and clearly a place like Utah, they don't have that hospital capacity, and we have to take aggressive action to make sure that those hospitals don't go under, that they don't have to go into crisis standards of care. This can be prevented if we actually start to decrease the number of cases by taking common sense actions.
And in rural areas, Dr. Adalja, it's also where we see a pronounced politicization of masking and other public health safety issues. Gabe Gutierrez from NBC spoke with the mayor of Sioux Falls, South Dakota, who's pleading with residents to wear masks. Here's what he had to say.
I think there's an increasingly high level of fatigue, Gabe, especially in the rural parts of the country, because we were told back in May and June how bad it was going to be, and it never came. Well, now it's here.
And you've got the governor of South Dakota, Kristi Noem, tweeting over the weekend, quote, "If folks want to wear a mask, they are free to do so. Those who don't want to wear a mask shouldn't be shamed into it, and government should not mandate it." So that's the mixed message you're seeing from the top, from the president on down, and especially in red states. Dr. Adalja?
Yeah, paradoxically, some of these rural areas don't have hospital capacity, and they're the places getting hit hard because they don't have these big academic centers in major cities that can absorb a lot of patients. And you also have that coupled with the fact that because they weren't hit hard in the spring, they think that this was not something that could ever get to them. And while it's true that you can't necessarily extrapolate New York City to every part of this country, every part of the country is at risk for having undocumented chains of transmission starting and then landing people in the hospital. So the key is that we have to get people to just take these common sense measures of wearing a face covering, trying to stay 6 feet apart, avoiding crowded places, and we will go a long way towards staving off this pandemic. But if we continue to see people have mixed messages where people think that it's okay to go outside when you might be infected and expose other people, you're going to get the results that you see in North Dakota and South Dakota currently.
And Olivia, I wanted to share what Dr. Nancy Messonnier of the CDC said at a briefing on February 25th about the virus.
Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness.
It's notable that we have not heard from Dr. Messonnier since. She really was, not only sidelined, but silenced in what normally would have been CDC daily briefings during a pandemic. Olivia?
Correct.
If you could speak to that, I'm sorry.
Correct. And that is why you saw the vice president actually take over the task force. It was that moment. That was the breaking moment, is that she spoke very honestly and was telling the American people the truth. And so they silenced her. And they continued to try to silence the CDC and Dr. Fauci and Dr. Birx whenever they would say this is going to get bad. And look, back in April, Dr. Fauci said publicly, we will have a horrible winter and a horrible fall, depending on how this response goes. We are there. We're living it now. We're watching this happen across the United States, and the White House continues to ignore this. It's terrible. It's terrifying.
And Dr. Adalja, there's a report over the weekend by Laura Strickler and Jeff Bennett and others on our team about the morale just plummeting at CDC, and that depending on how the election goes, there could be just an exodus of doctors there.
Yeah, this is one of the worst aspects of the pandemic. The CDC is the premier public health agency in the world. I remember the first time I ever walked into there and the awe that I felt being around in that building, around those people that are really kind of heroes and icons of the field. And to see them be demoralized, to see them put in the back seat, to see them be attacked, not for anything they did wrong, but for their virtue and for their expertise, really is mind-boggling to me. And if we lose that caliber of people at the CDC, we will suffer for years and years to come. That's one of the biggest priorities that needs to be fixed, is getting the CDC back to its prominent role, letting those individuals that know this virus, know infectious disease, to the forefront again, and speaking to the American public on a daily basis.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.